This video is divided into 3 parts. The first covers different methods of treating varicose and spider veins. Many patients ask, why do I have varicose or spider veins? The causes include a family tendency, hormonal influences such as estrogen and progesterone make blood vessels soft and expandable, pregnancy puts a lot of pressure on the veins of the leg, working for long hours while standing, and growing older makes veins more stretchable and leaky. Normal venous blood flow out of the leg is from the calf muscle. Blood cells are pumped back to the heart like squeezing a toothpaste tube. This exhaust flow stops at rest, then gravity pulls blood backwards down the leg. Normally, valves stop this reverse flow, but when the vein is overly stretched, the valves don't close. Blood rushes down the leg in the wrong direction, further expanding veins below the abnormal leaky valve. Valve leaflets can either stretch or become damaged. This process spreads from one valve to the next, causing varicose and spider veins to form in this exhaust system. The outpatient methods used to treat veins include sclerotherapy, the method that uses injections into the veins, ambulatory phlebectomy, an improved surgical method in which veins are removed by tiny punctures, closure, the newest and least invasive surgical method in which the veins are collapsed with radio frequency, and laser or intense pulse light, where veins are treated with light energy and closed by controlled heating. Sclerotherapy, the most commonly used method, can be used for removal of spider and varicose veins. A solution is injected into the veins to cause them to swell shut and slowly be absorbed by the body over weeks to months. The procedure of sclerotherapy involves using a hair-thin needle which is gently inserted into the vein. A small amount of a solution called a sclerosing agent is gently injected. Very minimal pain is experienced. A series of treatments are usually necessary to achieve the desired results. The injection method is shown here. The vessels appear to vanish with each injection just like magic. However, it will actually take several months for these spider veins to disappear as the body slowly reabsorbs them. Several solutions can be used to treat abnormal veins. The main solution is a detergent or emulsifying solution called sotradecol. It has been approved for use since 1946. Another similar solution, polidocanol, is pending FDA approval. Other solutions sometimes used are hypertonic saline or a combination of salt and sugar. Sotradecol and polidocanol are typically pain-free during injection. The end result of the injection process is that the solution flushes out the red blood cells, gently irritating the inner lining of the vein. The vein then swells shut. Formation of fibrous collagen tissue occurs over the next few weeks. The body's own healing process absorbs this residue of the vein over a period of 1 to 6 months, depending on the size of the vein. Immediately following a treatment, a number of small hive-like bumps are seen at the injection site, often accompanied by bruising within several days. Here is a picture of the back of a knee, a common location for spider and small varicose veins. After 2 injection sessions spaced 1 month apart, the veins are slowly disappearing. Ambulatory phlebectomy is the modern, minor surgical method to remove larger varicose and blue veins. It is a relatively simple in-office procedure, which is performed with local anesthesia only. The patient is usually not sedated. Tiny puncture sites make ugly, large scars a thing of the past. Here is a brief example of removing a vein through a pinpoint incision. This modern surgery is very different from the vein surgery of the past. The end result of this puncture and hooking technique is that the targeted veins are actually removed, so that only one treatment is required. For longer sections of varicose veins, a separate session may be required. The tiny puncture marks slowly disappear and are usually gone within 3 to 6 months. The large varicose vein clusters seen here on the lower legs are completely gone after one treatment. A few small puncture marks remain at 1 month post mini surgery. These veins should not return. For the RF closure technique, a small catheter is used. A small needle puncture guided by ultrasound under local anesthesia provides the entry point. Radio frequency is applied as the catheter is slowly withdrawn. The energy is computer controlled for added safety. Radio frequency applied through small electrodes heats up the vein wall. The vein wall shrinks and collapses as the catheter is pulled back. The closed vein is slowly reabsorbed over months. This technique is the newest, less invasive substitute for stripping of the saphenous vein. Shown here under ultrasound is the shrinking of a vein. The large dark space of the varicose vein shrivels with this technique. The catheter is seen placed in the vein. The most high-tech method is laser or intense pulse light. The laser method is used for some of the smallest spider veins. It is the method for people afraid of needles. Newest lasers allow even larger veins to be treated more safely and easily. This clip from the Today Show features one of the newest light-based methods of treatments. Computerized settings are available. With special delivery systems placed on the skin, bright flashes of light are used for the elimination of spider veins. Lasers for leg veins have been improving since the early 1990s. Lasers require placement of a crystal or aiming beam on the skin. Pulses of light are then emitted. They travel in milliseconds to the blood vessels. There's a feeling of a grease splatter or rubber band snap, although this is reduced by the newest skin cooling methods. Multiple treatments are usually necessary over several months. Recent advances allow the use of lasers even for patients with ethnic skin. Laser or pulse light works when red blood cells absorb heat from the laser or light pulse. Red blood cells in the spider veins get heated, causing the veins to shrink and close up. There's a gradual slow disappearance of the vessel over several weeks.